So what if I told you the future of affordable cancer treatment might just hinge on one company's massive, high-stakes bet? It's a story about a truly gigantic prize, and it all kicks off with one unbelievable number.
$25 billion. Just let that number sink in for a second. I mean, that's more than the entire economy of some countries. It's an absolutely staggering figure. So what on earth in the world of medicine could possibly be worth that much?
Yep, that's the cash one single drug brings in just 1 year. $25 billion. That prize, that massive sum of money, is what sets the entire stage for the story we're about to get into.
Okay, so what is this miracle drug, and why has it become such an enormous target for the entire pharmaceutical industry?
The drug at the very center of all of this is called Keytruda. Now, this isn't your traditional chemo, it's what's called an immunotherapy. Basically, it supercharges your own immune system to go and fight cancer. And it has been a total game changer for treating all sorts of cancers, from lung cancer to melanoma.
And when you see it like this, wow, it really puts it all into perspective, doesn't it? That huge bar, that's Keytruda's sales from last year. And look how it just absolutely dwarfs what we would normally consider a really successful drug. Keytruda isn't just a hit, it's a titan, a true giant in its field.
All right, so to really understand the strategy here, how anyone could even think of competing with a drug this huge, we need to get a handle on two key terms, a biologic and a biosimilar.
And this is the big question, right? A drug that can do so much good, why does it have to cost so much? Well, the answer really lies in how it's made.
You see, Keytruda is what's known as a biologic. Now, unlike a simple chemical drug like, aspirin, biologics are actually grown in living cells. We're talking about large, incredibly complex molecules. The whole process, the research, the development, the manufacturing, it's just enormously difficult and expensive. And of course, that cost gets passed on.
And that brings us to the other side of the coin, the biosimilar. So if a biologic is the super complex, super expensive original, what's the alternative?
It's pretty clear when you see them side by side. On the left, you've got the original biologic drug. It's pioneering, it costs a fortune in R&D, and that leads to that high price tag. But then, on the right, you have the biosimilar. It's a highly similar, almost identical copy. Now, it's still complex to make, for sure, but it gets to skip that whole initial discovery phase, which is exactly why it can be sold at a much lower cost.
Honestly, here's the best way to wrap your head around it. A biosimilar is to a biologic what a generic Tylenol is to the brand name Tylenol. It's the exact same principle, just applied to some of the most advanced and complicated medicines we have today.
And this is where our main player, the Indian biopharmaceutical company Biocon, enters the stage. They're looking at this landscape, and they don't see a challenge, they see a massive opportunity.
And you don't have to take my word for it. Here's the company's CEO, Shreehas Tambe, laying out their mission loud and clear. They aren't just making one biosimilar, they're building an entire portfolio. And the stated goal? Providing affordable access for patients.
And their plan is basically a triple threat. They're going after a biosimilar for Keytruda, which we've been talking about, but they're not stopping there. Nope. They're also developing versions of Perjeta, a breast cancer drug, and Prolia for bone conditions. This is a very clear, very aggressive move into the cancer treatment market.
You know, a big play like this doesn't just happen overnight. This is all part of a bigger plan. Biocon recently bought an entire global biosimilar business, which gave them the scale and the tech they need to go after the biggest fish in the sea. But here's the thing. In the world of biosimilars, you can't just release your drug whenever you feel like it. It's a race, but it's a race against a very specific clock. This timeline really lays out the long game they're playing. We start in 2023, with Keytruda at its absolute peak. Fast forward to 2026, and Biocon is already planning to show off its biosimilar. But the real finish line, the date that's circled on everyone's calendar, is 2028. That's the magic date when Keytruda's patents finally expire and the floodgates open for competition.
So the crucial point, the real strategic genius here, is that all of the development, all the trials, all the manufacturing setup, it's all happening right now. So that the very moment that patent wall comes tumbling down in 2028, Biocon can hit the ground running.
Okay, so this is way more than just a clever business move for one company. This whole thing has some pretty profound implications for, well, all of us.
The arrival of a biosimilar creates this incredible domino effect. First, you get competition in a market that used to be a monopoly. That competition, naturally, starts to drive prices down for both the new drug and the original one. And the end result, the most important part, is that these life-saving treatments become accessible to way more people.
And that's really what's at the heart of this. While the numbers are in the billions and the corporate strategy is complex, the goal is actually really simple. Make cutting-edge medicine affordable. It's about closing the gap between a scientific breakthrough and the actual patients who desperately need it. Which kind of leaves us with this big, hopeful question. Keytruda is just one of many of these blockbuster biologics with patents that are going to expire in the next few years. So, are we standing on the edge of a fundamental shift? A new golden age where our most powerful medicines finally become available to everyone who needs them? Well, only time will tell.